Hi, it's Colleen again. Good morning, because it's 1 o'clock in the morning. My plan for this video today is to go through the official comorbidities of EDS, which are many, to tell you about the ones I have. To discuss some of my daily life with EDS and see where we go from there. Hopefully it won't be that long of a video. I am a fidgeter. I do sometimes just need to think. A lot of times my mouth is faster than my brain, so sometimes I have to pause to let my brain catch up to my mouth. That can be a problem too sometimes, Anyways, so comorbidities of EDS. And I'm going to read the official ones. I thought I had it on here. I thought I had it pulled up. So I'm going to tell you the ones off the top of my head real quick. Immune system problems, meaning autoimmune disease, or you can have immune deficiency. Me, I'm lucky. I have both. Heart issues, aortic, dilation, aneurysms, tachycardia, MALS, which is mesenteric artery ligament syndrome, and that's mesenteric artery is being compressed, and then it causes abdominal pain and issues. You can have neuropathies, multiple sleep disorders, chronic pain syndrome, chronic fatigue. Oh, God, the fatigue. If only I had energy, I'd be so happy. To me, that's the word. I can live with the pain. I can live with the insomnia. I can live with the not sleeping. But the just dragging my ass constantly, because I just am so tired. I literally had a burn patient victim look at me one day at work. It was my third 12 in a row, which would make anybody tired, especially when you have an hour-long commute, each way. And I had just literally days before been diagnosed with narcolepsy. And I was standing there introducing myself to her, and I fell asleep for a couple seconds. And this woman who had a horrible event in her life and was incredibly sick looked at me and said, "Oh, honey, I wish I could just put you to bed and tuck you in and let you go to sleep." Well, number one, how kind of that woman. Number two, how tired, how bad must I have looked for a patient in that situation to literally be wanting to put me to bed. Of course, we've just more of the comorbidities. Functional gastrointestinal disorders. That's the gastroparesis, the intestinal dysmotility, the colonic inertia, which is just colonic dysmotility, chronic headaches, pelvic floor dysfunction, which I touched on a little bit yesterday because that's one of my major issues, and that's one of the reasons I was sent to the geneticist. Endocrine gland issues. I've been diagnosed with adrenal insufficiency, but it comes and goes during stressful periods of my life. Think about that. Kind of weird, right? Sometimes I'm kind of okay. Sometimes I'm not. Autoimmune diseases. Hashimoto's seems to be very common, especially among the women with EDS. Autoimmune urticaria, which is very common and linked to Hashimoto's. That just means you itch like fuck constantly for no gosh darn reason, and nobody can figure out why. And you get red blotchiness and that kind of stuff. Cardiovascular disorders, aortic aneurysms, aortic dissections, hemorrhaging. There's some valve issues that can be involved. We talked about the orthostatic intolerance, which is a dysautonomia, aka autonomic nervous system dysfunction, POTS, orthostatic intolerance, orthostatic hypotension. Okay, this is something that people don't realize. You change the basic structure of an organ, and you change the way it functions. And so most meds are designed to be metabolized in either the liver or the kidneys. The liver and the kidneys are two very vascular organs. They're 100% full on connective tissue. You change the building block of the connective tissue, you change the way the organ functions. And so my med reaction list or med allergy list is, I believe, 34 meds long. And if you are a medical professional, you know that you're looking at that med reaction list and you're going, yeah, right, Chico's crazy. But the thing is these reactions are ridiculously scary. Let me just tell you that Altram and Wellbutrin cause grand mal seizures in me. All the sulfa, all the penicillin type antibiotics cause full-on anaphylaxis. I mean, full-on anaphylaxis. With latex, they can do blood work to find out if you are allergic to latex. I don't pop up as being allergic to latex, but my skin is so fragile that it causes blisters. So it's on my medication allergy list. High-dose lidocaine that they gave me for, they were going to do a radiofrequency ablation in my back to help with my abdominal pain for my dysmotility. And, well, there's several things that play with this reaction, but it's the scariest reaction I've ever had. So because I've had so many abdominal surgeries, everything in my, abdominal cavity area, including the back of my abdominal cavity, my waist area, has revascularized, which means that the blood vessels are no longer where a normal person who hasn't had, 8 abdominal surgeries, blood vessels are. They've either remodeled or they've remapped themselves, and so nobody really knows where those blood vessels are. So when they were giving me the high-dose lidocaine prior to the ablation, I ended up with what's called inadvertent lidocaine toxicity. And basically that means that the lidocaine ended up being injected directly into a major blood vessel. I went blind. Everything anybody said to me was muffled. I had trouble breathing. Well, I felt like I was having trouble breathing. But they said that my lungs were clear and that my pulse ox was okay. I was terrified because I couldn't understand what people were telling me and I couldn't see them. And my entire body was numb. I didn't know what to do. They didn't know what to do. So they gave me many, many doses of epinephrine, and Narcan, and steroids, and within about 45 minutes, things started coming back to normal, luckily. But that's a terrifying experience that nobody should ever have. Many of us with EDS are diagnosed with fibromyalgia. We are diagnosed, sorry, that would be my dysmotility speaking. We end up diagnosed with what is called, I'm thinking, mast cell activation syndrome, which means that our bodies have allergic reactions to nothing at all. Nothing at all. I can, mine is more the, oh my God. My reactions are more the autoimmune urticaria. But mast cell activation syndrome, you never know what you're reacting to. So you're basically carrying an EpiPen and waiting to have an allergic reaction to the air, to a glass of water. The testing for that would be a high tryptase level. Mine's been borderline high, but never high enough to be diagnosed with that. We have muscle weakness, ligament tendon weakness, hypermobility, early onset osteoporosis, early onset arthritis. I told you about the neurological issues, the brain fog, the narcolepsy, small fiber neuropathy, just crazy shit. Cervical spine instability, general spine instability, tethered cord, sleep disturbances. Like I said, I've got somewhere around 4 different sleep disorders. I told you about the chronic pain, bleeding issues. Let's see if there's any that I'm missing. Like I said, the chronic pain. A lot of us have epilepsy. And most of us have migraine issues. I will tell you, for me, the Aimovig has been a godsend beyond belief. Now let's talk about the different subtypes of EDS. There's the classical EDS, which is autosomal dominantly carried. There's classical like EDS, which these guys are the ones with the real saggy skin, the real loose, hyperextensible skin. The classical like EDS is autosomal recessive. I'm going to look at another scale real quick. There's the hypermobile type, which is autosomal dominant, even though we don't have a identified genetic defect for that one yet. They are doing a study, a worldwide study, trying to, find the genes, the genetic mutations that cause the hypermobile, because the hypermobile seems to be the most common. and it is autosomal dominant, and we know that because you can track it through the families. Vascular type, which is what I have. Usually you have thin translucent skin. You can pretty much see all my blood vessels for the most part. Our artery and organ rupture, I've been lucky so far. Vascular type is the only one that will shorten your life expectancy. Gingivitis, slow wound healing. Yeah, that would be me, definitely. There's the chromosomal X, which is autosomal dominant. There's not much known about it. There's the kyphoscoliosis type, which is autosomal recessive, and it causes retinal detachment. But you can get that with any of them, but it's just most common in the kyphoscoliosis type. Microcornea syndrome, tearing of the cornea, which I've actually had several times from contacts, so I can't wear contacts anymore. Glaucoma and severe scoliosis. There's a arthrochalasis type, which is also autosomal dominant. And it's got congenital hip defects, dislocations. Oh, that's another thing that happens with EDS is we dislocate, we sublux all of our joints. There's the dermatosparaxis type, which is skin fragility. Skin is soft, doughy, and saggy, bruises easily, which I do. So you gotta understand there's a lot of symptom overlap between the types. So just because it says the symptoms for this type are these, that doesn't mean that a person with a different type can't or won't have those symptoms. It's just kind of those types have it more often. There's periodontal type, and I feel for these people. I really do. There's no consistent evidence to support an inheritance pattern, so we don't know if it's dominant or recessive. Generally, they have aggressive periodontic disease. They lose their teeth at a very young age. That's an issue that happens with all EDS, but with the periodontal type, it seems like it's just uncontrollable. And if you look at my teeth, they're very white. They would be straight if my Shar-Pei hadn't eaten my retainer years ago, and I keep trying to have a new one made, but they want like $300-400. And so I got these little gaps, and they bother the crap out of me, but my teeth are very, very well taken care of, and as a nurse, I know the importance of healthy teeth. I mean, your teeth are a major contributing factor to the health of your entire body. So I've been lucky with the teeth. Thank God, because my OCD would make me out of control if I were to, and I'm somebody who has that dream that you are losing all your teeth, that they're just falling out. I know other people have had that dream because I've talked to other people and they're like, oh yeah, I get that dream all the time. It's horrific. It's scary. It is. It absolutely is. Let's see. Let me see, what else can I tell you? I'm getting to the point where I will probably... Oh, small fiber neuropathy for some reason is pretty common in us, in EDS patients. They're not sure why. And if you can imagine, having chronic pain from early age, this stuff starts when we are young, but we are looked at like we are crazy. I started with constipation in 3rd or 4th grade, and the nuns and the nurse at my school just kept always saying I was trying to get out of class because I'd start throwing up. It led to an eating disorder. Eventually, many things led to an eating disorder as a teenager. And in my early 20s, somehow I managed to get control of that on my own over the years. But I also used to have severe OCD about working out. And if I didn't work out for 3 to 4 hours a day, I mean, working out was more important than doing my college homework. It really was. I'd go on an hour of sleep daily just so I could get my workouts in, make it to college, make it to work. Worked 3 jobs, paid cash for my nursing school out of my pocket, no help from anybody. I did it myself. And I still managed to have an eating disorder and obsessive compulsive about working out. I wish I could work out now. One of the biggest comorbidities, especially in women, is pelvic floor dysfunction, and we're going to talk about this at some length because this is one of the major things that I have. It's probably the reason I was diagnosed. I had I suffered endocrine-wise. Things were not good. You know, I've got Hashimoto's, and I, for some reason, stopped producing progesterone at the age of 29 or 30. I suffered from severe endometriosis and mild adenomyosis my entire life. I had horrific periods, literally about bled to death, until I had my hysterectomy, and about 3 months later, my H&H was 9. We would usually transfuse between 7 and 8 on a normal patient. So, think about that. So, of course, I finally after we did everything to do progesterone replacement, and none of it stopped the bleeding. I literally bled for 5 years straight. And when I mean straight, I mean daily. Never stopped. There was not a break. Men out there, I dare you to bleed from your groin, from your balls. We'll say from your balls for 5 years straight. I dare you. It wouldn't happen. You guys would kill yourselves first. So we tried everything, and an IUD that literally infused progesterone into my uterus did not stop the bleeding. High-dose progesterone replacement, oral replacement with the IUD did not stop it. There was nothing we could do. I finally decided, you've been trying to get me to have a hysterectomy for 5 years, and I can't keep. At the time, I was on 2 prenatal vitamins and high-dose progesterone and an IUD, and my hemoglobin was still barely 9. It was usually between 8.5 and 9. So obviously something needed done. If you don't know about what your hemoglobin should be, 13 would be a great number. It would be a good number. 9 is not a good number. Anyways, somehow, so they did it laparoscopic, supracervicular. They took out the left ovary because it was very cystic. Supracervicular means they left my cervix. It went pretty smoothly. However, and he told me, he said a lot of women will still have mini cycles if they have their cervix, but the cervix is supposed to help prevent vaginal vault collapse. So anyways, I just continued to bleed. I didn't have a uterus, and I'm still passing massive clots. Right? And then my colon stops working completely, and I can feel something pushing out through my bottom when I'm trying to have a bowel movement, and whatever it is blocking me from having a bowel movement. I had a grade 3 cystocele, which means I had a surgical requiring bladder prolapse, internal bladder prolapse. I had a grade 2 rectocele, which means my rectum was prolapsed into my vagina. I had a grade 2 external rectal prolapse. I had a perineal cele, which means my perineum, the muscles that are supposed to be holding all these things up and in place, was actually herniating through my rectum every time I bared down to have a bowel movement. The scans showed that, I'm going to tell you right now, the worst test you can ever have in your life is called a defecatory test. And literally they're taking x-rays of you pooping after you've drank cups and cups of barium, after they've given you a 500cc enema of barium, after they've injected 50 cc's of barium into your vagina and made you rub it around so they can get an idea of your urethra and all that good fun stuff. Then they make you sit on a little potty chair and poop and push while they're taking x-rays of it. It is so, I don't even have the words to explain to you what that is. But in a situation like mine, it gives information that is gold. It is so necessary. It showed that my perineum actually sat 3.5 inches, so over 9 centimeters below where it should be. It was completely detached. It was just kind of laying there. I had a total VSD detachment, which is vaginal septal detachment. It's what showed the perineal cele, and then the doctors, the colorectal surgeons, were able to see it when they had me bear down. Horrible. I lost all dignity and all privacy in 2015. I had student after student, resident after resident, nurse and doctor and tech and x-ray tech and radiologist all be looking all up in my junk and my rectum and everywhere. So all that is related to pelvic floor. Well, then I was having hip issues too. I had severe piriformis syndrome in both hips. And even though I was doing PT, it wasn't getting better. And it wouldn't get better. It didn't. Well, your pelvic floor is directly related to your hip function. a lot of the hip muscles are also used to support the pelvic floor. So, because my colon was so full of stool, because it was completely paralyzed, I was on 2 doses of Linzess a day. Linzess is like a Roto-Rooter for constipation. I was also on several motility drugs to try to move this stuff through. And then I was on 10 to 12 doses of Miralax as tolerated per day. And there were still days where I had no bowel movements. I threw up to 20 times a day. I lost 60 pounds in 2 months at that time. And it took a year for me to find the right doctors. I had 2 colorectal surgeons look at me and say, "Honey, we can't help you. We do not have the qualifications or the skills to do what needs to be done to fix you." The fourth Euro-GYN finally said, "Yep, I can help you, I can fix you. But we have to do a joint surgery with a specialized colorectal surgeon who specializes in pelvic floor dysfunction." So luckily that year, Cleveland Clinic had just started a pelvic floor center. I ended up with a total colectomy with an ileostomy for 3 months. So they were supposed to use mesh to make a sling and then build out of my own tissue a barrier between the mesh and my bladder and all that, and where they had removed my colon so I didn't end up septic. Well, once they took the weight of my colon out, and it did perforate as they were trying to take it out, so even if everything didn't try to move back into place on its own, they still would not have been able to do the second part of the surgery because my abdomen was so contaminated with stool. Because my tissue was so thin and my colon was so full, just trying to take it out, it tore. The Euro-GYN was like, "Colleen, I couldn't do anything. I would never have been able to do anything because your entire abdominal cavity was 100% covered in stool." She's like, "But the good news is all of those organs that needed to get support had moved their way back up slowly. So we're going to watch, and if you need something later on, we will, fix that." They did have to do extensive work on my rectum because I did have the internal prolapse, the external prolapse, and I also had what's called rectal intussusception. So basically, my colon was tunneling over my rectum and obstructing it. So they did have to do work on my rectum. They had to remobilize it and stabilize it and da 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 da. There's a lot of stuff they had to do, even though they couldn't do the mesh and the barrier. I then, 3 months later, had the ileostomy takedown and reversal. That did not go well. I ended up in the hospital for 21 days, 10 of which I had an NG tube. I was 1 day away from them starting Hyperal, which is total parental nutrition. I would have had a specialized recipe of IV fluids, dextrose, and vitamins and minerals and protein going into my PICC line. The day of my colectomy, that hospital stay, I missed my oldest son's 16th birthday. I was hospitalized for his 16th birthday. When they did the ileostomy reversal, I was hospitalized for my 17th wedding anniversary. We had been together 23 years at that point. Married for 17. And then I ended up, we went to Florida, after I finally got out. I got cleared to go to Florida. I was sick as a dog. I do mean sick as a goddamn dog. I had essentially had dumping syndrome, and then we discovered I had C. diff, and within 12 hours of returning from a 2-week vacation in Florida, I was admitted for dehydration and C. diff, and in the hospital for another 5 days. Let's see. I was also admitted for dehydration a couple other times. Admitted for severe abdominal pain. And vomiting. They decided I have functional dyspepsia from my dysmotility. 6 months later, because I was still having the dumping syndrome issues, even being on Imodium and Lomotil, they put in a sacral nerve stimulator, which ended up infected. So it had to be removed, and then I had to wait 3 months for it to be placed again. So that 6 months later, guess what? My small bowel shuts down. So now I have to keep the sacral nerve stimulator turned down. It helps with my overactive bladder. And then in March of 2018. At that point, I ended up having a bunch of little surgeries. But in March of 2018, I had a CT scan show that I had a partial rotation of my small bowel due to an adhesion coming from my old stoma site. They talked about doing a partial bowel resection depending on if it was strangulated or not. And while they were in there, they were going to do lift my bladder, because I had another urodynamics study that literally showed I'd pee 350 cc's and still have over 650 in my bladder. And that was after 3 or 4 attempts to empty my bladder. And that showed on 3 different tests those numbers, and because I had such huge urinary retention, it would be dangerous to use mesh to fix the cystocele, because it could pinch off the urethra, causing more urinary retention. And at that point, I was already having so much retention that it was backing up into my kidneys and causing kidney stones and abnormal kidney levels. This year alone, I've had 3 surgeries on my rectum and my pelvic floor. So, just women out there, and I've only had 2 kids, and I've done Kegel exercises since long before I had kids, all the time. So you women out there, know a couple things. There is such a thing as pelvic floor physical therapy, and they are wonderful. If you have EDS and you have severe pelvic floor issues like I did, and I mean, I was a mess. In order to pee, I had to push my bladder back up inside of my body and squeeze it to push the urine out. In order to poop, I had to go up into my vagina, push the rectal seal up as high as possible so that the stool would not be stuck. So they call it splinting in physical therapy. But it's a nightmare. It's not what you should need to do. No one should have to do that in order to use the bathroom. No one. So, know that there is help. Cleveland Clinic has a fantastic pelvic floor center, pelvic floor specialists. I know there's more and more hospitals working on getting pelvic floor clinics, because it's important. It doesn't just happen to EDS patients. It just happens worse to us. So if you're having issues like this, get it checked out, dude. You don't have to live that way. It might be embarrassing, and you might lose all sense of personal space and privacy. But the fact that I can pee without having to stick as much of my hand up into my vagina as possible to push my full bladder up and help empty it, that is gold. The fact that I'm not wetting myself all the time because I can't empty my bladder and so it's overflowing is gold. I mean, think about it. It's gold. So pelvic floor dysfunction is almost 100% guaranteed in the female EDS population to some degree. And it's an embarrassing thing to bring up, but it needs to be brought up. It needs to be talked about, and it needs to be taken care of because you're worth it. And living the way I did for years, was not worth it. And especially if you have dysmotility of the GI tract, you're very likely to have pelvic floor dysfunction. And in fact, sometimes pelvic floor dysfunction can cause intestinal dysmotility. Thanks for watching. If you're here, that's great. Like I said, I fidget a lot. I drink my water a lot because my mouth gets really dry. I know it's a long video. It's got a lot of good information in it. And it's information that's important, especially for the female EDS population or for females who might have EDS and need to see a good geneticist. A lot of people will try to send you to a rheumatologist to get diagnosed. That's not what rheumies do. I mean, they can, and if they're good enough at doing it, at doing the diagnosis, more power to them. But in most cases, they erroneously diagnose people with something else. So a good geneticist is worth their weight in gold. And finding one, you're going to find, typically the better ones are at children's hospitals. They're linked with children's hospitals because think of how many babies and children are born or develop syndromes. You know what I mean? Well, I'm going to sign out and, subscribe. Listen to my boring talks. I know. I'm crazy. Watch me fidget. But I have been told many times that my history is very interesting and I should either write a book or make a movie about it. I may not be great at explaining everything. I may not be great at telling stories or talking, or I am not a public speaker. So I'm sorry. I do use some foul language sometimes. That's me. That's gonna happen. If it offends you, I'm sorry at this point. Sorry. That's the sorry you're going to get, the only one, because if I drop an F-bomb, I drop an F-bomb. It's just, that's just me. But thank you for watching. Like I said, I gave some very important information. If you have symptoms or you're diagnosed with a whole crap ton of weird stuff and you look up Ehlers-Danlos syndrome and you think to yourself, wow, I might have this, find yourself a good geneticist. Alright? They can't do much, but they can monitor you for, your heart health, for your osteoporosis, do DEXA scans. They help refer you to the right places, with Ehlers-Danlos syndrome, your life is going to be physical therapy, physiotherapy, and doctor's appointments. In the next video, we will talk about some of the mental health and the neurological changes that this crappy disease causes. And well, have a great weekend, everybody. I say everybody, but I've had like 7 views, but we'll get there, maybe. Maybe people like me. Usually people think I'm pretty likable. And shoot me questions if you have anything. Alright, thanks. Have a great weekend, guys. Share it, like it, and subscribe.